Hello, my name is Gabby Fennessy. I'm a Senior Risk Advisor in the Health and Education team. My job is to advise organisations on risk, and often I talk to boards and executive groups about managing their risk in health services. Internal audit in the health sector works in a range of ways. Just like any other organisation, internal audit is there to provide assurance for the board. Traditionally, internal audit in healthcare has provided assurance around payroll, financial areas, purchasing, that type of thing. It's been fairly unusual for internal audit to actually move into the area of core business, which is in healthcare provision. Traditionally, clinical audit has been developed often by people's personal interests and passions. It's happened in lots of different ways and the scope has varied enormously. We see internal audit of clinical areas as a natural evolution of internal audit, using the rigour, the systematic approach and the assurance that healthcare organisations are looking for. Why undertake internal audit in healthcare? Well, just like any other organisation, healthcare organisations have boards which want assurance that the organisation is working properly and that money is being spent appropriately and that all of the controls that the organisations say are in place are actually working. Some of the key challenges for internal audit in a healthcare organisation is actually understanding the core business of a healthcare organisation, which is to provide patient care. In the organisations that VMIA visits, we look often at the internal audit calendar or schedule of the activities that are going to be covered. Those often include, as I've referred to before, payroll, purchasing, financial issues. They often are not the ones that are on the strategic risk register or have any link to clinical risk. Key processes for board members and Audit and Risk Committee members in relation to internal audit is to develop and think about the key topics that need to be audited or for which the organisation seeks assurance. Traditionally, as I said, these have been in financial areas. We are trying to expand that into clinical areas. That means that audit and risk really need to talk to subject matter experts, to clinical leaders, to understand the areas of clinical risk to the organisation. These need to be added into the mix and become part of the priority area for audit and risk committee to instruct the internal audit moving forwards in the organisation. Part of this work will include looking at the risk register and understanding the risk profile for the organisation. On that profile, we would expect to see areas where there's been high risk, high cost, high variation of practice and potential patient harm. These are areas that should be considered for internal audit. Key message for internal audit in healthcare is really to reflect on what is your core business, that is in providing patient care. Therefore, there should be some internal audit activities that respond to patient care and to clinical risk. When thinking about topics for internal audit, make sure that you engage subject matter experts across the organisation to think about areas of risk exposure. You might also like to look at your clinical risk register to understand areas where there is patient harm or where the organisation is exposed. The toolkit for internal audit of clinical areas has been developed because this is a very new and different approach to internal audit. Many organisations have asked that they want to use the rigorous approach to internal audit but needed some help and guidance. VMIA has come up with some generic tools for internal audit, including the audit tools, guidance about what it's about, what the role of internal audit is. We've also prioritised two areas where we know there is risk across the state. This includes emergency department and urgent care centres and maternity services. The toolkits that VMIA has developed in collaboration with experts and subject matter experts is to provide easy to use guidance that's there available on our website for free. It can also be used as a new business opportunity for internal audit firms to utilise these particular tools with healthcare organisations.